Hot application. It is an application of a hot agent that is warmer than the skin to promote the healing of an injury. The purpose is to relieve pain or congestion, vasodilation, and increases blood flow to the affected areas, promote relaxation of muscles, and to promote the healing of soft tissues. There are special considerations. Clients with malignancies, acutely inflamed areas, open wounds, and edema. Special considerations for pediatric and geriatric patients are to observe. Assessment. Check if the patient has been injured recently. 24 hours after a traumatic injury could worsen if hot compress is applied. Check for any skin disorders that a hot application could be worsened. Hypertension or other circulatory issues should be noticed and addressed before doing the procedure. And for the nursing diagnosis, for patients with muscle discomfort, problems with the proper circulations of the blood and the skin, or muscle strain. Determine the related factors for the nursing diagnosis based on the patient's current status. Appropriate nursing diagnosis may include but are limited to the following: acute pain, chronic pain, impaired skin integrity, impaired tissue integrity, delayed surgical recovery, risk for impaired skin integrity, and risk for injury. And for the outcome identification, the expected outcome would be the patient's states pain relieved, displays increased in comfort, verbalizes decreased muscle spasms, exhibits improved wound healing, and demonstrate a reduction in inflammation, remains free from injury, and verbalizes understanding of reasons behind treatment modality. And for the planning, determine what supplies and equipments are needed, wash hands for infection control, and obtain the needed equipment. For the equipment, hand washing materials, hot water bag with cover, bath thermometer, waterproof pad for under the hot water bag, and pitcher. Cold application. It is an application of an agent that is cooler than the skin to relieve pain, body temperature, to anesthetize an area, to check hemorrhage, to control bacteria, to prevent gangrene, and to reduce inflammation. The purpose is to elevate the patient's body from stress and to promote comfort, to reduce swelling, and to control pain. It helps the joint pain caused by an arthritis flare and to decrease muscle spasms. The assessment are to check patient's body parts of their sensitivity to the cold application, the inner aspect of the wrist and forearm, the neck, and the perineal area are temperature sensitive, while the back of the hand and the foot are not as sensitive. Check the injured area for its sensitive than intact areas to temperature variations. And the tolerance to the cold is also affected by age and physical condition. The young and the aged are very susceptible to cold. And the thinner layers of skin of adults and children increases the risk for burns from the cold application. The nursing diagnosis is for the patients with engorged breasts, bacterial infections, post-surgery care, sprains, fractures, and muscle spasms. The outcome identifications would be decreased inflammation, patient does not show signs of bleeding or hematoma at the treatment site, patient states that the pain is reduced, patient verbalized understanding of the rationale for cold application. For the planning, determine what supplies and equipment are needed, wash hands for infection control, and obtain the needed equipment. And for the equipment, compress may be a washcloths, ice bag, hand towel, or cheesecloths, basin for cold water or ice water, and plastic or rubber sheeting. Check the physician's order or nursing care plan for the application of heat therapy to properly administer adequate care for the patient. Identify the client for proper identification to prevent mistaken identity. Explain the procedure to the patient and assess the condition of the skin where the heat is to be applied. The skin should be in a condition safe for the procedure. Assess sensitivity to temperature and pain using light touch, pinprick, and temperature sensation test. Gather the equipment needed and perform hand hygiene. And make sure to close the room door or curtains. Raise the bed to a comfortable working height. Assist the patient to a comfortable position that provides easy access to the area to be treated. For the hot application, pour a glass of tap water to pitcher and follow with hot water. Check the water temperature. Fill the hot water bag with 2/3 full of water. Remove the air inside the hot water bag by placing it on a flat surface and allowing water near the opening. Close the bag. Check for the presence of leaks to fully secure the device. For the cold application, fill the bag, ice collar or glove about 3/4 full with ice. So, gloves yun. Next is to wrap the hot water bag with protective cover. Apply the heat source to the area indicated for the treatment. Assess the condition of the skin and the patient's response to the heat at frequent intervals according to the institution policy. Do not exceed prescribed length of time for the application of heat to ensure that you are not applying too much heat and to monitor the patient's response and how he or she is holding up to the procedure. Remove the bag after the prescribed amount of time has lapsed to avoid prolonging the heat compress. Assist the patient to preferred comfortable position so they can be comfortable after the procedure. Do aftercare of the equipment and dispose soiled linens. Perform hand hygiene and document the procedure patient's response and the assessment of the area before and after the procedure.